Good morning, everyone. I think we'll get started as people come to find a seat. Thank you. Good morning. My name is Dr. Andrea Gielen, and I have the pleasure of serving as the director of the Johns Hopkins Center for Injury Research and Policy here at the Bloomberg School of Public Health. On behalf of our center, I'm delighted to welcome you all, those of you in the room, as well as those of you who are joining us through the live stream webcast. Today marks the culminating event of our center's 30th anniversary year. The Johns Hopkins Center for Injury Research and Policy is a collaborative of injury prevention experts who conduct innovative research, teach today's practitioners and tomorrow's leaders, and translate that research into effective solutions that address the devastating and costly problem of injuries in our country. We are one of 10 centers for excellence in the United States that receives core funding from the Centers for Disease Control. We also receive financial support from private foundations, corporate funders, and individual donors who partner with us. This support is increasingly important and integral to our work at the time when government funding for injury prevention is on the decline. Our team is engaged in three kinds of work: research, training, and education, and outreach. As we look to the future, there are four topic areas that are strategic priorities for the center. These are home safety, substance use and misuse, which includes opioid overdose, violence and sexual assault against women, and the topic of today, transportation safety. The center's focus on transportation safety actually dates back to the very beginning in 1987 when our founding director, Susan Baker, made the discovery that infants riding in motor vehicles had the highest death rate of any age group. And her discovery, as you might imagine, led to the widespread adoption of infant car seat legislation around the country. 30 years later, our center continues to make new and valuable contributions to the field of transportation safety. For example, we've demonstrated the life-saving benefits of graduated driver licensing laws. We've documented continuing disparities in motor vehicle death rates, such as among American Indians. And we've published research on teen drivers, airbags, alcohol sensing, and interlock technologies, and public opinion on motor vehicle safety policies. The continued emergence of technological advances in motor vehicle safety is what brings us together here today. Technology that is designed to save lives, embraced by the public, and widely and equitably disseminated to the public are all critical to the future of transportation safety in this country. We come together today to update our collective knowledge of this quickly developing and exciting field and to explore opportunities for new research and new collaborations. We're extremely fortunate to have an outstanding group of experts convened here today. And I invite you to sit back, relax, and enjoy the program. And we're really excited to kick off the program with our department chair, Dr. Colleen Berry, the Fred and Julie Soper Professor and Chair of the Department of Health Policy and Management. Dr. Berry's department focuses on advancing health and social policy to improve population health, and it's also the home of our injury center. So thank you, Dr. Berry, for being here.
It's such a pleasure to be here with all of you this morning and to be able to participate and learn from this wonderful event. The Department of Health Policy and Management is so proud and honored to be the long-term home of our injury center here at Johns Hopkins, and together with our collaborators in other departments and other schools in the university to be able to be fundamentally involved in advancing the national conversation around injury prevention in this country. I've had the great honor to work with wonderful faculty and staff in our injury center and to collaborate with them on areas of joint interest to the extent that many of our areas of work, even if we're not injury experts per se here in the School of Public Health, touch fundamentally on issues around injury and the health of the public. And I know and am reminded regularly from my wonderful injury center colleagues that public health is advanced in a very fundamental way through our attention to the air that we breathe, the roads that we drive on, the communities in which our families work and play and enjoy our lives. And I'm proud of the fact that every day here at the Johns Hopkins School of Public Health, we are making a difference in improving the lives of individuals through injury prevention and safety, through our research and through our public health practice activities. I'm particularly happy today to be able to be here with all of you to focus on the role that transportation policy and safety plays in advancing the work of public health. This is fundamental to our school, to our department, and to our obligations as researchers and community leaders in advancing public health. And I want to acknowledge the important collaborations that allow our work to be impactful through connections with many of the experts that are here today, and to focus on aspects of this issue that relate to technology, to ethics, to the role that government can play, and to injury prevention from a variety of different disciplinary perspectives. Welcome to those experts that are here with us today, and thank you for joining us. And welcome to all of you, and thank you for focusing on this critical public health issue. And finally, I want to end my brief comments by extending my enthusiastic and heartfelt congratulations to those leaders in our injury center who have been working on this for many years. It's been my great pleasure to have gotten to know Sue Baker and to understand her work, and to all of you on the occasion of the 30th anniversary of the center. Here's to 30 more years of injury prevention and more. And with that, I'm happy to turn it back over to Andrea.
Okay, thank you very much, Dr. Berry. We're going a little bit out of order. Our transportation seems to have delayed one of our speakers. Maybe the transportation folks can work on that next 30 years. So our next speaker, our first speaker, Matts-ake is an adjunct professor at the KTH Royal Institute of Technology in Stockholm, Sweden. He is a senior advisor for the Swedish Transport Administration, and he's responsible for the development of the Vision Zero Academy. He's a global expert on road traffic safety strategies. And today's event actually marks the beginning of a new collaboration between our Injury Center and the Royal Institute. And it's been a pleasure to get to know Mats, and we're just delighted to have him here to talk about Vision Zero and autonomous vehicle technology. So thank you for being here.
Okay, thank you for this kind introduction. I think we are seeing a very exciting time, actually, and it's extremely important now to get the public health community to be involved in things that happen now. But before I get into that, I would like to give you a little bit more in-depth knowledge about Vision Zero. And I think, a matter of fact, that there is a kind of global culture, safety evolution going on. I could call it a revolution, actually, because when we introduced the car in our society, there were a kind of perception that it's up to every individual to survive in a harsh environment. We didn't really care about it. But the next step then, when we start to see that, no, this is a problem, and we have to do something about it. But we thought that it's a kind of price that we have to pay for our mobility. But now I see around the world now, more and more country jurisdiction, they started to think that, no, this is not acceptable. We can't accept that people get killed and serious injury when they transport just from A to B. And I think that the Swedish Parliament was one of the first nation, and Sweden was the first nation now that really expressed that when they adopted this Vision Zero in 1997. So this year we celebrate the 20th anniversary with Vision Zero. And basically that was an ethical imperative. It can never be acceptable that people are killed or seriously injured. But for us who've been working with this now since the beginning, it's something much more than that. Vision Zero is a new paradigm in the way that we work with safety. And one way for me to explain this paradigm shift is to compare it with a more traditional approach. In a traditional approach, the problem that we try to solve is the problem with accident or crashes. And we know from in-depth studies that 90% of all crashes is due to human factors. So we have focused very much on it. It's kind of mantra that 90% of all fatal crashes is due to human factors. So we have put the ultimate responsibility on safety on us as individual road users. So if something goes wrong out there, we can always find someone to blame. And our strategies has been very much based on the idea that people don't want safety. We have to educate them, we have to enforce them, and so on. And we don't think in a traditional approach that we can really eliminate this problem. So we are quite happy if we can step by step reduce the risk. But we think that fatalities is something that we have to accept, and it's a price for our mobility. So that's why we're talking about a kind of optimum number of fatalities and serious injuries. Vision Zero as a policy challenged all these aspects now. The first thing is that Vision Zero, the problem that we try to solve is not the problem with the accident per se. The problem that we try to solve is the problem with fatalities and serious injuries. So that is the problem that we try to solve. And according to Vision Zero policy, the reason why people get killed and seriously injured is because people are people. People make mistakes. In a traditional approach, our focus is very much to creating a kind of perfect human being, or always doing the right thing. But Vision Zero said that that's not possible. We have to accommodate for children, for old people, all kinds of people that are using our systems. And people are fragile. We know quite a lot now how much energy the human body tolerates without any serious injuries. I used to take one concrete example to just explain the difference between this traditional approach and Vision Zero. If you have a typical intersection, four-lane intersection, and you have a safety problem in that intersection, in the traditional approach, we set up a traffic light. And when you do that, the number of crashes will be reduced. But those who will happen will be very severe, because the typical scenario is that someone, by mistake, go against the red light, and due to the speed, the outcome will be very severe. But if you have a roundabout, the number of crashes actually might increase a little bit because it becomes a little bit more difficult to drive in a roundabout. But those who will happen will be less severe because of the kinetic energy. And a traffic light and a roundabout might actually be the difference between life and death. So in a Vision Zero kind of approach, the ultimately responsibility on safety is on us as system designer. We are the ultimate responsible for safety. And of course, the road users still have a responsibility, but when something goes wrong, it goes back to us as system designer. So in a Vision Zero approach, we are now moving a lots of things that we thought as a behavior problem, we move it to a design problem. So for example, in Sweden now, there are lots of discussion about alcohol, for example, that we're moving driving problem from a kind of behavior problem to a design problem. Vision Zero is also based on the idea that people want safety. When people know what the options are, they go for the safety option. And of course, in the long run, we would like to eliminate fatalities and serious injuries. So this is a paradigm shift in the way that we think about safety, and to implement things like Vision Zero, to achieve a safe system, technology become very crucial. And here is the thing. This shows the mobile cellular subscription per 100,000 inhabitants in Sweden, 1990-2014. And as you can see, in the late 90s, we started to see mobile phones coming in our societies. And of course, from a safety community perspective, we start to think about this as a problem, distraction problem. We didn't know really why it was a problem. We first thought that the problem was to handle mobile phone, but that it turns out that that might not be the biggest problem. It's probably when we're speaking on the phone. And now we're talking very much about not look at the phone when we're driving and so on. Of course, that is an important topic, and it's important to discuss it. But this technology is not only bad for our society. We have to understand that there is a really opportunity now with this new technology. So, first of all, we have to realize that this is a very complicated stuff, you know. It's not only that it have negative effects. It seems that also that this technology, you have some compensatory behavior things that we actually is good from a safety point of view. But that's not the important thing. The important thing is that you can start to use this technology as a road safety tool. For example, 8 of 10 calls to our emergency hospitals in Sweden now go through a mobile phone. It's very much used as information to police. For example, if someone sees someone drinking driving, they will call the police. And also we start to use this kind of technology now for information and senders and receivers. And we can start to work with speed and other important things from a safety point of view. And we are very much dependent now on this technology. For example, I have an application in my mobile phone that helps me to keep track on the speed on the roads in Sweden. If I'm driving too fast, it will give me an alarm that I'm going too fast, for example. And this kind of technology now has a great advantages, and we can start to work with it. So the safety communities must realize now that we can take advantage of this technology. And of course, this has also other type of positive effects. For example, when you are in a queue, congestion time become a value time because you can start to use it with this technology. And also, when you have this technology, you might not have to be so much exposure in the traffic. And also, we will get much more data from this system. So from a Vision Zero point of view, we would like to see much more discussion about how to use this as a tool for road safety. And when it comes to vehicle technology now, which many of them are based on this kind of technology, we can see lots of promised technology. Of course, alcohol locks, intelligent speed adaptation systems. This is also a kind of alcohol lock. It's a key. If you blow in it, you can't, and you are influenced by alcohol, you can't open the door and so on. lane departure system. There are lots of different techniques around the world now that start to implement. But the public health community, we need to start to be engaged in this discussion now. It seems that our strategies now evolve very quick. We started very much with information and campaigns and education. Then we set up regulation, and hopefully we get the police to start to enforce this regulation. But now we're moving to the next phase. You see very much of technology and enforcement, safety cameras, speed cameras, and so on. And the next phase is in this process is, of course, in vehicle technology. So I will thank you and stop here, and thank you for your attention.
Thank you, Mats, for that important context-setting discussion of Vision Zero. I'm thrilled to introduce to you now Mark Rosekind and to welcome him back to our school, where he has been our special guest on many occasions and is in large measure responsible for getting us to today's event. He helped us launch our 30th anniversary year at the beginning when he came and spoke about autonomous vehicles and public health, which really set the stage for a year of exploration on our part, which he contributed to immensely. Let me tell you a little about Dr. Rosekind. He served on the National Transportation Safety Board from 2010 to 2014, when he was appointed by President Obama to serve as the 15th administrator of the National Highway Traffic Safety Administration. There, he championed the role that autonomous vehicle technology can play in improving safety on all our roads. And during his oversight, he led the agency in the development of the Federal Automated Vehicles policies and initiated the founding of the Road to Zero Coalition that is developing a 30-year plan to eliminate traffic fatalities. Mark made the transition to the private sector earlier this year, and he is now the Chief Safety Innovation Officer at Zoox. Mark will moderate our panel on transportation technology as a public health intervention, but first he will introduce our keynote speaker, the Honorable Anthony R. Foxx. Thank you, Mark.
There are three things you need to know about the Honorable Anthony Foxx. Three things. But there are a whole bunch of other items that didn't make that list. Things like he was the 17th Secretary of the Department of Transportation, which of course means he had purview over the entire transportation system for the United States, including its 55,000 personnel and $70+ billion budget. That didn't make the list, okay? He came to that from being mayor of Charlotte, North Carolina, where he'd also been on the council and had been in private practice. And his education that got him there was from undergraduate work at Davidson College, where he broke some barriers as a student body president, and then went on to NYU Law School. That's all the stuff that's not on the list. What are the three things you need to know about this man? One, he just announced last week his new position. He's now a managing partner and founder with Related Infrastructure. I hope we're going to hear more about what that exciting new adventure will mean for all of us, actually. And the other two things on that list, he has a superpower. That one is actually identifying opportunities for change. People love to throw around visionary. That's nice, conceptually. What Secretary Foxx is really superb at is identifying where there are not just needs, but opportunities we can make changes that will benefit all of us, which is very appropriate for what he's going to be talking about today. And the third thing is people love to throw around leadership, but what Secretary Foxx has brought to everybody who ever associates themselves with him is he is an individual who finds ways to lead, guide, support, and do whatever he can to make the people that work with him successful. When you put all that package together, all of us really have benefited from his service to our nation as the 17th United States Department of Transportation Secretary. Please help me welcome a good friend, Anthony Foxx. I'll stay.
Thank you, Mark Rosekind, and I want to thank everyone here at Johns Hopkins for having me visit with you today. I see David over there, and a great friend. Let me just say that I'm excited that you're having this conversation today, and thanks for the great leadership of this wonderful university in convening a conversation about the transformative power of technology and the possibilities to improve safety. I'm going to tell you a couple of stories. First of all, Mark's introduction was way over the top. But I did happen to have a front row seat for 4 years as the U.S. Department of Transportation was trying to figure out how to harness the power of technology to solve problems for our country. One of the chief problems being an increase in the crash rate and the fatality rate in our country. So let me back up a little bit. I walk into the U.S. Department of Transportation on July 2nd, 2013. I take the oath of office. I say, all right, now that I'm king of transportation, tell me where are our biggest problems? And the first issue that was presented to me was that we were seeing declines in traffic fatalities and crashes actually at the time. We were seeing declines in other areas. The one area we were seeing an increase was in pedestrian and bicycle safety. And at that point, I said to our team, I said, we have to figure out a way to harness our efforts around that area, because we had a mode for cars, we had a mode for trucks, we had a mode for airplanes, we had a mode for rail, we had a mode for transit. There is no mode within USDOT for walking. And so it became sort of a cross-department effort to begin to focus in on this. The thing I learned about it in the context of this, and this is very critical as we think about technology and how technology gets deployed, is what occurred to me as we were going through the process of developing our pedestrian approach was how little the Federal Department of Transportation really engages with cities, where a lot of these things hit the ground. And if you think about the U.S. transportation system, it's very different than most systems around the world. Most systems around the world are federal systems. And so when a technology needs to be adopted in France, France can adopt the technology because there's more of a federal approach to these things. And most countries work that way. But in the U.S., we have a shared system of responsibility among government. And the Federal Department of Transportation obviously takes a big stake in laying out rules and regulations regarding safety, but there are limitations to that power. There are some powers that have traditionally fallen to the states. Power to regulate insurance, for example. The power to set driver's requirements, for example. And I'll get into this in a little while, but the point is that when we talk about how we actually get technology in a position to help us become a safer country, it is actually a serious exercise in federalism. And we've got to understand that from the very beginning. So, on with my story. So, we put together a pedestrian safety approach. As we were doing that, I started to turn my attention to our vehicles. We had some challenges when I first came in the door. The GM ignition switch issue, David, you'll remember that fun experience. We had Takata, which the airbag situation arose, and what we learned, and I think Mark and David would both say this, what we learned was that you can spend all of your time reacting to the problems that come across the transom. But if you don't have an affirmative theory of the case, if you don't have something that you are actually proactively trying to do, it will never get done. So where our department was situated vis-a-vis technology when I walked in the door was we were working hard on a vehicle-to-vehicle communications approach. And the vehicle-to-vehicle communications approach is one where cars would essentially have the technology to communicate with each other using a broadband signal. There were questions about which broadband signal to be used. There were some folks in the government who wanted to sell that broadband, and that debate will still rage for a little while. But as I talked to people out in the world, I started to realize there was more than one way to try to approach the safety challenges. And another way to try to approach it was sensor technologies that would behave much like you and I do behind the steering wheel, that would see the environment around them, make safer choices perhaps than you and I would make. I think Matt said it very well. 90% of our crashes and accidents today are the result of human factors. And so there was a debate out in the community of technologists, let's say, about whether vehicle-to-vehicle communications was the only way to solve for these human factors. So I came back to my team and I said, team, are we putting our thumb on the scale in favor of one of these versus another one? And everyone said, no, we're not doing that. But we didn't have an answer really for what would happen if we started to get effectively an autonomous vehicle walking through our door that did not use vehicle-to-vehicle communications, but did use sensor technologies. And at that point, Mark had come in, and we had several conversations, Mark. I remember this because I kept saying, what are we doing, what are we doing? And you kept saying, look, man, if I can dig out of my hole with GM and Takata, I can spend some time working on this other stuff. But literally, over the course of about a year and a half, we spent hours and hours, and I remember late nights when we were going over drafts of the autonomous vehicle guidance, which, frankly, I think, as much as people who follow this stuff very closely understand how important that was, I don't think it's really gotten the kind of attention it deserves, because that autonomous vehicle guidance is a cornerstone of an approach that is still being followed even by the current administration. And the importance of that is that it gives the industry a clue as to how the U.S. Department of Transportation intends to regulate them, how we intend to ensure that they're doing their best job of safety standards. And there are pieces that I wish and hope will continue to be debated and discussed over time, but largely our approach is being followed. Now, technology is great, but it's not foolproof. And I think another component of our conversation has to turn to those areas where it's not foolproof. The fact of the matter is we're going to have accidents even with the very best technology. And we can debate how you set rules for technology when the vehicle is actually learning, where you have deep learning occurring in a vehicle, and how do you actually regulate that? We had deep conversations in the department, for example, about creating outcome-based rules and regulations rather than prescriptive rules and regulations. Currently, for example, the federal motor vehicle standards say that you are supposed to have a pad on a car that a human foot can touch to stop the car, a brake, basically. And that's a very clear prescriptive standard. But for cars that won't have a physical brake, maybe what we say is that we need a mechanism to stop the car. So it's a sort of a different way of getting to the same answer, but being more outcome driven in the way that we set rules. But even notwithstanding that, I guess the point that I want to make, the big take-home point for you, is that I still see a little too much specialization in the development of these technologies. In other words, I think we have engineers who are good-hearted and have good minds for technology. But if I could borrow a phrase from the late Daniel Patrick Moynihan, transportation is too important to be left to engineers. And by that, what I mean is we need a variety of disciplines helping us understand how to make the best of what's available from a technological standpoint. So let me offer a couple of thoughts about that as I close. One of the things we've discovered about how our infrastructure is built is that pedestrian and car safety has to be thought of as a single thing. In other words, any interaction you and I are going to have on a street with any other mode of transportation has to be thought of not in stovepipes, but thought of together. In Atlanta, for example, one of the things we noticed was that, and frankly around the country, more than half of our low-income communities across the country don't have adequate sidewalks. And without adequate sidewalks, you are running the risk that people are going to end up walking in the street at a time when cars are passing by, and those are going to be the places where you have higher than normal accident rates. And so on a built environment basis, we still need public health folks engaged with our transportation and traffic engineers. The same is true with technology. And I will give you an example from our Smart City Challenge that we did. This was what I thought was one of the coolest things we did at USDOT is we despite some of the advice of my staff, we put together $40 million of USDOT money. We then harnessed another 10 from a foundation, and then we found partners to put in-kind support. And by the end of it, we had about $90 million that we made available to one city. Columbus, Ohio won this bid, but one of the things that they were able to do in Columbus is they have a 4 times the national average infant mortality rate in Columbus. It's been a problem for them for a long time, and they were very concerned about this before the Smart City Challenge. But I was struck by the fact that what they did was they figured out a way to rope in the concerns around infant mortality into their package. And so what they endeavored to do is to create an app that a mom can use to sign up for a doctor's appointment. And as she's signing up for the doctor's appointment, the app will also create a transit trip for her. And if the doctor's appointment gets moved or if she's not able to make the bus, it automatically gets rescheduled without her having to do anything. There were 2 other problems Columbus tackled in this. One was, well, what if mom doesn't have a credit card and can't use an app? They were able to create a cash-based system so that she can use cash, not just having a credit card. And they also placed kiosks in the neighborhoods where the infant mortality rate was higher than normal so that moms could have the access to those apps if she didn't have a smartphone, because we still have 25% of the public that doesn't have a smartphone. So these public health challenges in transportation and technology can be connected to each other in a way that solve problems, but they'll never be connected that way if decision makers aren't thinking about them in holistic ways. The last point I want to make before I close is in our transportation departments across the country, whether they're state, federal, or local, I would feel very strongly, and I do feel very strongly, that we need to expand the palette of disciplines that we invite into our transportation offices across the country. I think there needs to be a head public health official engage with the U.S. Department of Transportation, engage with the State Department of Transportation, engage with the local Department of Transportation, because it is with that discipline, that particular discipline, working in conjunction with planners and engineers, that we're going to get a better product out on our streets and out on our roadways. So I really want to tell you how much I appreciate what you're doing. I apologize that I have to run down to Washington, D.C., and I'm going to try not to create my own public health challenge in the process of getting back down there. But When you call, I wanted to answer, and it's been great to be with you, and good luck with the rest of the conference. Thank you.
No pressure now, but we got a great panel coming up. Perfect. Secretary Foxx just demonstrated that superpower that we were talking about, identifying opportunities, and this panel is going to get even more in depth. So if I could get our panelists to come up, great. So we have 4 panelists. They're going to be with us, and each of them has a few slides to show. And so what we're going to do is I'm actually going to introduce individually speaker. We're going to go right in the order that we're all planned here. And so I'll just give you a name and title. They'll have 5 minutes to talk, 3 slides. You can count with me. And they'll know the 5 minutes are up because I'll be right here standing when we need to keep it going. We're going to do that so we have 20 minutes for them to present, and then we're going to have a panel discussion with all of us and with all of you. So, Keisha, you ready to start? Yep. All right, so we're going to start with Keisha Pollock Porter. She is a professor and director of the Institute for Health and Social Policy and an associate director of the Johns Hopkins Center for Injury Research and Policy. That's where her work focuses on transportation safety, the built environment, and the application of epidemiologic methods to solving public health problems. Keisha.
Thank you, Mark. As I pull up my slides, you'll see I have 5, including my title slide and my end slide. So, and there's an image in there that moves that you might say is really 4 slides, but it's really not. I promise you, it's only 3. All right. Great. Thank you so much for that introduction. Let me just jump right in here and just, as an epidemiologist, I want to make sure we're all on the same page in terms of data around crashes and to just remind you about how things are in our society today. We know that in 2016, there were over 37,000 individuals killed on US roadways. And this was about a 5.6% increase from 2015 data. So many of us know these numbers, that's why we're here today. We know that over 2.4 million people were injured in our most recent data in terms of these crashes. We also know people are driving more. Vehicle miles traveled increased from 2015 to 2016. And when we look closer at the fatalities, about who's dying in these crashes, we know that almost half of passenger vehicle occupants who we know about their restraint use were unrestrained in their vehicles. We also know that the number of young drivers involved in fatal crashes has increased as well, up almost 4% since 2015. And as we heard earlier, the number of pedestrian and bicycle fatalities has continued to rise and in fact was the highest number in 2016 since the early 90s. Matt and Secretary Foxx both mentioned that we know that about 90% of serious crashes are due to dangerous choices or errors that people make behind the wheel, and NHTSA has actually said that number is about 94%. And this is partly because of what Matt said so eloquently, people are people, right? And we don't show these numbers to highlight or to emphasize blame, rather to understand and to seek solutions. So when we think about the potential for technology to save lives, many of the conversations we hear are targeted towards these crashes that are related to human choice. So thinking about deaths due to unrestrained passengers, or to speeding-related fatalities, or alcohol-impaired driving fatalities, or distracted driving fatalities, drowsy driving fatalities. There's potential for vehicle technology to really address these leading causes of death and to address that human choice element. Well, what does the epidemiology or these data mean really for autonomous vehicle technology? And I want to just highlight a few things before I wrap up my time. First, as I just said, there's great potential to address these human choice factors, right? To really think about how can technology help to create safer environments, help people to actually make those safer choices, easier choices. I think there's also great potential when we think about the added benefit of autonomous vehicles when combined with other types of existing technology. We already heard from Matts about ignition interlocks for impaired driving. What's the added benefits of having autonomous vehicles as well? And finally, when I hear people talking about the great potential of autonomous vehicle technology to save lives, I really think that this potential will only be realized if we pay attention to the differences that we already know exist by race, ethnicity, other socio-demographic factors, those inequities. And in order to really achieve that potential, we have to ask ourselves, will everyone have access to this technology? Will it be affordable? Are we going to really get to the equity issue? And I want to highlight or just leave you with this image that I think really captures what we're talking about. You know, if we think about autonomous vehicles, the image on the top shows 4 different people, and we're basically giving everybody the same amount. The concept of equity reminds us that everybody starts, or certain groups start from different places. And we have to think about how do we give those groups what they need so we all succeed and all have the greatest health possible that is achievable in this country. So with that, here's my contact information, and I look forward to the conversation with the other panelists. Thank you.
I did say no pressure, but great job. Next is Nancy Kass. She is the Phoebe R. Berman Professor of Bioethics and Public Health at the Berman Institute. That's where she developed a unique and important ethics framework for considering public health interventions. She also serves as the Vice Provost for Graduate and Professional Education for Johns Hopkins University. Please welcome Nancy.
Thank you. Let me also do this slide thing. Hope you're not counting this against my minutes.
No, you're good.
Oh. Okay, great. Okay, thank you. Thank you for inviting me, and I'm so pleased to be part of this conversation today. So I was asked to talk about ethics, and ethics in a general sense is about promoting benefits and reducing harms, and in the process, as much as possible, allowing people to still have free choice, at least where it doesn't harm others, and ensuring fairness, both in the distribution of good and bad things and in the processes by which we come to our policies. In public health, we tend to be grounded of all those things. We pay attention to all of them, but we're grounded significantly, and this is not something about which we are at all apologetic, in our commitments to promoting benefits and preventing harms. In our school, we frame that as saving lives millions at a time through any number of interventions, seatbelts, vaccines, helmets, things that, again, promote benefit and prevent harm. But public health in our country significantly is a government function. Baltimore was the first city in the country to have a board of health in 1793. And now every state in the country has a Department of Health, and it's there to ensure the conditions in which we can be healthy. It's there to think about things like making sure we have safe water, safe food in restaurants, investigations of outbreaks, things that when it's doing its job well can be mostly invisible to the public. Along with this, in order to do its job, public health has something called the police power, whereby it can restrain and coerce people in order to protect the public's health. From an ethics lens, we may then want to ask more than whether we are saving lives. We may want to be asking how we are doing that, and at what costs, and who are the winners and who are the losers. So when a new public health intervention is proposed, we might ask a few more questions. We might ask, what is the public health goal? Are there data that show that that goal, logical as it seems to many of us that the intervention will lead to that goal, that it really will? What are the harms or burdens that might be created along the way, and what are the things we could do to try to minimize those? Fairness, as I said, who wins, who loses, and what's the impact of a new technology on disparities? Does it make them wider or does it diminish them? And then how do we figure it all out? So let me say a few things about ethics and autonomous vehicles. This is obviously not my area, but with the help of friends, I've been trying to learn more about it, and needless to say, It's fascinating and important and raises so many important questions for public health, but as I'm going to close with really for society much more broadly, which I think actually creates some of the challenges compared to some issues that I think can be framed more narrowly simply as a public health issue. So some of the literature that at least I have seen that has started to address ethics and autonomous vehicles has focused on what some people call the ethics of the engineering design challenges. When a child runs in front of an autonomous vehicle, should the vehicle be programmed to hit the child, to swerve into a cement wall and threaten the safety of the passenger, or by bystanders on the side of the road? These are obviously agonizing moral choices, but that's not the area that at least I find the most vexing. The benefits of the cars have been raised by Keisha and by others. I'm certainly not going to repeat them. I want to talk for a few minutes about what some of the risks and burdens might be of these. There are a few that I'm not really going to talk about that are critically important, maybe will come up in the conversation. What happens to safety when there's a computer hack? How do we as a society feel about the privacy risk that now everybody will know? There's the potential to know where everybody's going all the time. I don't have a lot of secrets, some people do. There are further threats to the use of public transportation, to walking, to biking potentially, the easier we make it to hop in something. But I want to really spend time talking about two specific threats. So this is a map of the most common job by state. And I don't know how well you can see that, but that sort of aqua color shows that truck driver is the primary occupation for most states of the country. This is a remarkable slide in my view. And there are not only 2.4 million truck drivers in the United States, there are 1 million transit bus, school bus, taxi, or other drivers. There are about 500,000 auto body repair people, and there are 10 million people whose jobs are essentially depending on the trucking industry, through motels, through highway restaurants, et cetera. So this is not only an extraordinary harm, but if we think about the distribution of that harm, truck driving is the #1 occupation among people without a college education. So obviously, I'd like to be queen for a day, wave a magic wand and say, okay, education's the fix. I think we know that. Start to look at public schools in our cities, and we'll know that there isn't always a societal will toward that particular solution. So let me carry on with this fairness theme as the last harm, and just say that there are a variety of ways, I think Keisha started to allude to this, that autonomous vehicles could have a negative impact on fairness. If special roads are built for those who buy autonomous vehicles so that they can safely go much faster, which is good for safety, it is good for efficiency, but that means that, the rich get richer and the poor get poorer, right? So the roads are presumably for the people who can afford that, at least until we get to a time that autonomous vehicles are the only vehicles on the road. And it may threaten other infrastructure projects that might be really good for cities. And there's not, there is not an infinite budget. So I want to close by talking about how we might think about resolving these and why the solution to me at least seems so vexing. And a little bit to me, this builds on what Secretary Foxx was saying about interconnected systems. So traditionally in public health, we think about what's the burden of a very narrow public health proposal, right? If we feel in public health that we really need to do quarantine, we can think much more narrowly. Say, we owe it to those people out of fairness to make sure they have food, that they have water, that they have communication with their loved ones. It's much more complicated when there is a commercial product at stake. Autonomous vehicles are a tremendous intervention for public health, but I don't know if one could argue that they're being put in the marketplace for the purpose of public health. And when that's the case, when there's this kind of commercial interest and public health isn't leading the charge, it is more complicated to think about who's responsible for the winners and losers. And when the winners and losers are happening in these other social sectors, like jobs, which are so we think of health as our ticket, as our conduit to get us the lives we want to lead, right? When we have our health, we can have the love with our families and the other kinds of peace of life we enjoy. If we can't have that peace of life we enjoy by a loss of income, then we can't have the human flourishing we want. So I will end on that little bit of a downer, but hope we can get into more of it in the conversation. Thank you.
I'll take the folder and all
Oh,
the.
sorry, that's your fault.
That's all right.
Sorry, that would be
And,
bad. And I don't want to introduce
there you
anybody.
go.
Thanks.
I can sit over there. You can come over here. We can. Next is Jennifer Bradley. Jennifer is the founding director of the Center for Urban Innovation at the Aspen Institute and a former fellow at the Brookings Institution Metropolitan Policy Program. Her current initiative on cities and autonomous vehicles, a collaborative project of the Bloomberg Philanthropies and the Aspen Institute, offers important insights for our discussion today. So, Jennifer, please.
I am significantly PowerPoint challenged, so it may be a minute before I can get. Sorry about that.
Go ahead. Where's the? Where's the thing? I'm talking about challenge. This is like.
Sorry
okay.
about this.
No, we're two left-handed
Sorry.
people in a right-handed world.
Indeed. Oh, there
Yeah.
we go. Thank you.
Thank you, Keisha.
No problem.
Oh, there's the keyboard. It was hiding. Okay.
Yep.
Okay. Thank you.
Yep. Great. So, because I'm also over my slide budget, I will be quick. The Bloomberg Aspen Initiative on Cities and Autonomous Vehicles was a one-year initiative to support cities in, as Secretary Foxx might put it, really living up to their potential in a federalist system. Cities are where autonomous vehicles are being piloted. It is in cities, not in the abstraction of the federal government, that the impacts of autonomous vehicles will be felt. And so the hope that Bloomberg and Aspen started this initiative with was that cities could be proactive rather than reactive in decision making. We encouraged cities to set their own vision of autonomous vehicles rather than letting companies dictate the pace and course of this technology adoption. We were trying to help them, again, as Secretary Foxx would put it, develop an affirmative theory of the case of what autonomous vehicles could do in cities and how they could advance not just the goals of the technologists, but also the goals of city residents and city leaders. We worked intensively with 10 cities across the world, but we also wanted to amplify the voice and actions of the many cities around the world that are piloting and planning for autonomous vehicle technology. To that end, we did a survey and created a kind of a repository online of city pilots, which is at avsincities.bloomberg.org. As of this, my slide's a little bit out of date. As of this morning, we had 76 pilots in cities around the world. And the goal was for cities to share information about pilots and the planning that they're doing so that no city has to reinvent the wheel in their approach, and no city feels that it is by itself in bargaining with companies that are already being quite aggressive about pushing this technology out on the streets. We've heard from cities that have AV pilots. Sometimes AVs show up without the mayor necessarily knowing, without the transportation director knowing. A lot of the companies have an ethos of ask forgiveness, maybe, not permission. And so we wanted cities to be able to kind of get ahead of it and be able to say, we see that you're here, but here are some things that you need to do for us, and create more of a dialogue of equals. Make no mistake, though, cities understand that this technology has a transformative power, and they've been thinking about it for a long time. So if you look at this slide, most of our cities have been thinking about or planning for AV technology for about 3 years. They anticipate the benefits, but they're also aware of the drawbacks. What we've also seen is that cities have shown a readiness to look at implications of this technology well beyond their transportation departments. They are thinking about the public health implications. They are absolutely aware of the equity implications. And I will tell you that every single one of our US-based cities has seen, knows about, and almost all of them use in their presentations the truck driver slide that Nancy showed. They understand that this is a massive shift in labor market and labor market demand in their cities. And they're, again, trying to understand what they can do to get ahead of the impact. Cities are also thinking about extending and expanding their transit systems or their transit footprint with AVs, because they recognize that being stuck in traffic is a miserable experience, whether you are the one that is making the car move an inch at a time or whether you're in the back seat. And I think that some of the promise of autonomous vehicles, certainly in terms of commuter convenience and expanding the commuter shed, might have been oversold. There are a number of people, right? People who take the MARC train are kind of having an autonomous vehicle experience. People who take those huge coaches that come into Washington, D.C. from Columbia, Maryland, and other places, they're having an autonomous vehicle experience, and you don't hear them talking about how wonderful and productive they feel, between 7 in the morning and 9 in the morning, on I-270. So cities are understanding that traffic is traffic, and if they can use autonomous vehicles to augment and extend their transit system, that is a really good use of their resources and a good way to, again, make this technology meet city goals. Now, of course, cities cannot always implement their autonomous vehicle plans, and this last slide shows the barriers that cities have identified to implementation. Anyone who works with any level of government will be familiar with the statement, well, we just don't have enough money. But I would draw your attention to the other, pretty high responsive, that there's no capacity to manage pilot, and they're not sure what the issues are that require city action. That's where I think institutions like schools of public health or universities or think tanks or research institutes have an enormous role to play in augmenting city capacity. Right now, there is a shocking asymmetry of information between cities and the autonomous vehicle companies. And it would be extremely useful if cities had other sources, city governments had other sources of support to augment their understanding and help them get smarter faster. There is a great sense of optimism around this technology in city halls, but they don't want to be forced into situations where they're giving away too much or they're not able to anticipate some downstream concerns. The last point I want to make is that one of the messages of the initiative was that autonomous vehicle technology is the beginning. It is absolutely not the end of a major technological shift that will call for changes not only in some city rules, but also in how cities organize themselves to respond to new kinds of technology. This notion that new technology should be, as Andrea said in her opening remarks, widely and equitably distributed to the public. And this notion that new technologies will have an impact on disparities. These questions will continue long after AVs have, completed their transformation of the fleet. And so what I hope that we'll advance today and that we'll continue to advance through all our work is helping cities grapple with technology and equity questions, because those are the questions that are going to face them most strongly over the next decades.
And our next speaker, Shannon Frederelli. She is an associate professor and associate director of the Johns Hopkins Center for Injury Research and Policy, and that's where her work focuses on implementation science, which is a critical field to advance policies and programs that facilitate safe and equitable dissemination of autonomous vehicle technology. You know how to work this?
I don't have to work it
Okay.
because I don't have slides. So yes, that makes it easy, although, well, this is a nice slide. We'll just keep that up. Well, good morning, everyone. Thank you for being here. My job here today at the end of this wonderful panel is to really get us thinking about the ways that we can realize autonomous vehicle technology systems design change in a way that is safe and equitable. When we think about implementation, implementation is, at its essence, a strategy. It's a strategy for realizing how to achieve certain goals, like safe systems, like embracing technology for a better world, achieving that equity, achieving that fairness, helping cities along the way. And when I think about implementation and what we've learned about implementation over the years, there's really three key factors that we need to be thinking about. Apparently 3 is a common number that we're using today. So 3 key factors that help us to understand implementation and help us to understand, perhaps most importantly, how we can use what we know in order to move in a direction strategically so that when we start to realize in a big way autonomous vehicle technology, when we start to realize in a big way safe systems design, we'll do so in a way that achieves those goals that have to do with safety and that have to do with equity and fairness. So what are those 3 elements that we need to understand? Well, the first is what that strategy is about. We need to understand sort of the detail and the content, if you will, of that strategy. So strategies for implementation involve policies, they involve programs, they involve market-based initiatives, and the extent to which those initiatives, be they policy, programs, or market-based initiatives, are well spelled out, are clear, and are consistent with sort of the norms and values and expectations that we have as a society, the more likely we are to succeed in that implementation process. The second factor I would say that's really important for us to consider as we think about implementation and implementation in this context is part of what Jennifer was talking about, the people factor in implementation, if you will. Autonomous vehicle technology isn't going to just happen automatically. Safe systems aren't going to be designed overnight magically. And putting policies in place, putting mandates or guidance or encouraging these policies along ultimately are going to work or not, and are going to be safe and equitable or not, based on how people implement and receive them. So when we talk about people, it's both the implementers who are in charge of realizing, these strategic initiatives. It's also the public, the truck drivers, the drivers who are going to be feeling this change in a very real way. So are people that are involved in these systems changes, are they, sort of part of the conversation about what this means? Are they, given attention so that they can understand what autonomous vehicles mean in terms of safety, what they can mean? Do they believe that a safe system design is really about safety, or is it about some other agenda to simply slow things down? Because oftentimes on the face of some of these changes in public health, what we see without explanation are inconveniences in our life as opposed to the benefits. So assuring that as we roll out these different strategic interventions, that we pay attention and we acknowledge that people need to understand, both the people who are going to be responsible for realizing through implementation, but also the people who are going to be subject to the new rules of society. And the third factor that I'll put out there to think about as we move forward in our discussion today is context. So what is the context in which these interventions, these initiatives are being rolled out? Is safety, is equity something that we as a society value and are going to prioritize? Do we have time to prioritize safe systems? Do we have time to prioritize and be deliberate about our rollout of autonomous vehicle technology? We heard from Secretary Foxx that one of the greatest challenges he faced was sort of that decision about how to balance offensive strategies, accomplishing what he wanted to accomplish, what he saw as important for the future of transportation in the society, versus sort of the defense he had to play with the numerous problems coming on board, coming to his attention every day. So how do we balance that, and how do we sort of keep in check the matters that need addressing, but also pay adequate attention to where we're going in the future, and assuring that where we're going in the future is safe and equitable and in the best interests of all. I'll end there.
First, a thank you. On time, nobody was really counting slides. And the reason for that is because this is the fun part, right, for all of you and hopefully for the audience as well, which is the discussion that's coming. And I'm hoping to encourage interaction, not just me asking you questions and getting responses, but anybody in the panel has an opinion or a thought, please figure out how you want to interject that if you would, right? And we'll get to the audience as well. We've left plenty of time for us to have a discussion. I'd actually like to start at the end. And so Nancy was the one who said if she was queen for the day, well, I'm going to make each of you leader for the day. And for each of the areas that you talked about, I'd love to go down the table here and talk about the end point. If we were successful in each of the areas that you're talking about, in cities, in ethics, in the crash part, in all these different areas, what would, if you could paint the picture of what the end should look like, what would that be? And I'm going to give you a heads up. The question that's coming after that is, tell me 3 steps that'll get us there, okay? So they don't know any of these that are coming. It's part of the fun. So Keisha, why don't we go ahead and just start with you. If you had to paint the picture at the end, what would that mean for you?
Oh, you know, I thought when you said the end, you were going to start with Shannon, but I had a couple more seconds to think about that. Wow. You know, if I could just imagine, I would probably imagine a society where we have access to the critical data for monitoring, for measurement, that individuals are accessing data that look at the public health impacts, look at unintended consequences, that we're able to really measure things, that we have open lines of communication, data sharing agreements, people in city governments, state governments, federal governments are able to really access the data. You know, my talk was about epidemiology, so that's just such a critical part. I would also see greater connections between academic institutions, schools of public health, and other sectors, strategies to involve transportation sectors with planning sectors, with engineers. I spend a lot of time thinking about implementing strategies around health and all policies. I think that there's room here for that as well. So in an ideal world, we would sort of see more collaborations, more intention to measurement, and to really, again, focusing on measuring the benefits and also those potential unintended consequences that we didn't really think about up front.
Great. Nancy's jotting her.
So this part's just the vision and not yet
Tell me what the end's going to look like.
The end goal?
Yeah, what we're going to look like.
If I can really be whatever.
Leader for the day. There you go.
It's a world where people are safe and happy. I mean, I really mean that. And I think that public health interventions like this absolutely can be a ticket to get there if we do it the right way. Not the only ticket, but it's a piece. But the vision is a whole lot of, is the world full of people who are safe and happy.
Great.
So the vision I have for cities and autonomous vehicles is threefold. One, it's cities where the transportation journey and effort of the poor is the same as the transportation journey and effort of the wealthy. So we would not hear about 2-hour journeys to work on a variety of unreliable buses and trains that are limiting the earning chances and the life chances and just, you know, the ability to be happy and to be engaged with family life that you often hear about poor people. So an equivalent travel experience for rich and poor. The second is, and related, is that all residents, especially young people in a city, could take advantage of all of the extraordinary resources of a city, that horizons would be less bounded by zip code than they currently are. And third, I would envision a city where there's a lot more mixing in the public realm because we have invested in walkability and access, we no longer kind of fetishize cars and make them so important. They're about as interesting as a light post, so that we would have more interacting because we are no longer moving through space in these kind of wheeled suits of armor that we now use to navigate space.
Great. Janet.
Well, I actually thought you were starting down here too, so, and I'm realizing that there's a definite disadvantage, Keisha, to being last because you guys said so many wonderful things. So the vision, I would say, is not unlike what others have said, but I would add to that we have what perhaps is our most precious commodity given a bit back to us, which is time. I think that's one of the opportunities that this technology that we're talking about offers, is that we can not necessarily slow down physically, but kind of slow down mentally and enjoy life a bit more. I think there's also tremendous opportunity just in terms of the way that we work and the way that we interact, and we can start to dream a little bit bigger with this kind of technology, and that's what I hope for our world.
Great. And just to keep this interesting, we're going to start with you, Shannon. Give us at least 3 sort of specific items, actions, milestones that will help get us to that picture.
Sure. Well, I'll build on what Keisha started with, which is data, and it's actually something borrowed from Vision Zero. So a lot of what Vision Zero programming is about and what I would like to see us move more toward is design that's informed by data. So how do our designs need to be changed based on who is getting hurt? We can do that. Dialogue, collaboration, excuse me, I think is critical when we think about these kinds of radical changes that we're talking about for our society. So having real dialogue with all members of society is quite important. And then I would say, lastly, the third thing that we need to do is be responsive to both the data and the dialogue in terms of evolving or revolutionizing our transport.
Jennifer.
So I'm not even last, and I'm already building on what Shannon has to say. I think as we steer towards policies informed by data, we also need to make sure that the policies are informed by the least advantaged people who probably have the most to gain, but also the most to lose from this technology. So as we're thinking about pilots, for example, or as we're thinking about policy directions, are there people from disadvantaged or poorly transit-served neighborhoods at the table who can give us actual lived experience and insight into the problems that they need to be solved, which may not be problems that we can pick up on just from numbers. There may be some subtleties or some shifts that we need to be brought to the table. I think we need zoning and visions of the streetscape that prioritize human bodies over automotive bodies. I'm not a zoning expert, so I don't know exactly what that would look like, but other people do, and so I want them to do that. And I think we need to share data and experience across cities as much as we can. So again, in some ways, cities are in a bit of a race to make sure that their plans keep up with the pace of technology development, and being able to share not just nationally but also internationally, I think is very important to realizing that.
Great.
So I would want to see a lot of investment in autonomous public transportation and make all of that free as an incentive for using it. I would want for the clearer it is that a variety of autonomous technologies are helpful for the public's health, I would want to make them required because regulation is an equalizer. And then the third thing, which is a little bit wilder, is in response to this concern about the people who are losing jobs, and where for them and for a whole lot of other contexts in the United States, we really, really, really need to do something about improving our education system. And so I'm wondering if there could be, again, I'm just going to be queen for the day. I want there to be some significant tax on the cost of these that goes directly toward education funding.
And the three strategies that I would offer sort of echo some things my colleagues have said already. The first is really promoting data-informed decision-making. I think that ensuring that we are making decisions based on evidence in addition to the politics and all the other factors we care about. The second is I would promote authentic multi-sectoral engagement. I think the types of success and improvements we can realize with this technology could be achieved through closer engagement between public health sectors, healthcare systems, transportation, planning, engineering, et cetera. And the third would be really being intentional about equity and involving the community. You think about equity, at the root of equity is power, and thinking about who has the power in these decisions and who is involved in power and where's the voice coming from. So being intentional about engaging the public and individuals who could be disproportionately impacted by this technology is something I would do.
Great. So Jennifer, tell us something from your survey that we didn't get to hear in your 5 minutes. Any surprises?
So I think the surprising, I gave away the surprise in my remarks, but that cities are eager to look at this in a cross-disciplinary way. Cities want to, so Toronto, for example, has a very strong working group on cities and autonomous vehicles. So everyone is sharing information. Transportation is the lead in this working group, but zoning has an understanding, housing has an understanding, labor, workforce, permitting, they all are understanding, so that when there is a moment of decision, when Zooks, for example, might come into Toronto and say, hey, we'd like to do a pilot, everybody's up to speed and can say, oh, we have a wealth of problems that we would like you to solve. And so they're partnering both within cities, and they're able to be better partners with the technology companies. That readiness to change was a wonderful thing to see on the part of cities.
Nancy, you brought us one ethics problem. There's a classic one in this area called the trolley problem that everybody loves to solve.
Oh, yeah.
We're not going to ask you to solve that right now.
Thank you.
But talk about that, because what's interesting is these problems are already being solved every day in a moment on our streets. And I think part of the reason we're having a discussion about this is because, as folks have been talking about for a long time, now we're taking it out of the hands of the driver and putting it in the hands of coders or other people that are deciding what the engineering final pathway is. So talk about sort of that conceptual shift, because some of those ethical decisions are getting made every single day, the one you gave. But now all of a sudden we have a more, quote, proactive, preemptive opportunity to address them. How do we figure this stuff out and then find ways to actually get them integrated into the future?
Yeah, that's a great question. This is where I would pick up completely on what Keisha was saying about some community engagement. So I think there need to be a variety of voices at the table, and that not only, I think, provides a different kind of input, I think it leads to a certain kind of transparency at the end, which also seems really important. There is this funny thing that happens when we believe we're in control of decisions that makes us feel more comfortable. And even if it turns out that the way that the car is programmed is what people believe in and people decide is rational, it still makes people really uncomfortable to not be in control of it. So I think having this heterogeneous kind of input to decisions like this, I mean, there's no right answer to these decisions. You can make good art. That's why the trolley problem is in philosophy one in one of the first days, right? And so there's not a right answer. And figuring out what feels the most right to a group of people engaged, I think, is helpful. But it has to be a real conversation. And people have already done all these surveys. And I think the first answer to a survey is not real engagement.
And Keisha, the job displacement's already come up. And it's kind of interesting that with everyone, and everybody's acknowledged this, there's pluses and minuses to every one of these issues. Workers, you want to sort of talk about what that means from your perspective?
The issue of workers, I think that I could see both sides, right? So one of my areas of research is around occupational injury prevention, and we know for workers, motor vehicle crashes are the leading cause of death, right? So on one hand, you think there's great potential for autonomous vehicles to reduce the risk of fatalities amongst drivers who are on the road, truck drivers, other people who are behind the wheel. But I think that there's concern about the risk of job loss and thinking about those equity issues that Nancy so eloquently highlighted in her talk. I love that slide that just shows, the great prevalence of jobs in terms of truck drivers around this country. The other thing I think is important to consider when it comes to workers is the role of unions, and unions have spoken out against, some have spoken out against technology of this type because of the concern about jobs and job loss. And I think these are real concerns for families. And I think really authentic engagement will help to really think through these issues a bit more. Getting people together to talk through, is there a way that we can ensure the safety of drivers? Because that's what they want. They don't want to go to work and be killed, or they don't want to go to work and be injured. And I think that's really important to remember. And I encourage all of us who think about rollout of this technology, what's the best way to do that that's going to cause the least harm and also keep people safe at the end of the day?
Jennifer?
One of the things that came up in the conversations that we had with our cities, and it was seeded by David King, who's a professor at Arizona State, was this notion of how much drivers do not driving work. So if you think about getting on a city bus, if I'm getting on a city bus late at night and there are some people on the bus and I think, am I safe with that person? I impute that the driver of the bus will have some kind of protection dispute resolution role. If you think about, an elderly person in a taxi cab, and you think that the taxi driver might help her bring her packages to the front door, there are non-driving tasks that drivers do. And so one of the things that we hypothesized is, could you value those caregiving, caretaking, or if you want to give it a fancy word, those concierge type services, and think about if we are having people with physical impairments or people with visual impairments move through the city in AVs, would there be someone also in the vehicle to navigate the sort of car to destination transition? Could we think about replacing the mechanics of driving with things that humans do, right? One of the exciting things about technology is it frees humans to do what only humans can do, because it takes the machine stuff off of our plate. So could we have a society in which there is more care in our daily life, and is that a way to manage the job transition? The challenge with that is we have never valued and paid care work like we have valued and paid mechanical work. So let's use this opportunity to kind of bust up gender conventions as well while we're at it.
We're going to solve a lot of problems with this new,
I'm on it.
And Shannon, not to leave you dangling out there, but from implementation science, tell us where that's going to play a role in all of this. Not just in the halls of academia and research, but when we're talking about really making a change in all the issues we're hearing about, where can this really help?
Yeah, so where can it help in a number of ways? So, I think of all the conversations that have been happening here, and there's a role for implementation science in all of this. So thinking about how we structure our policies that are going to really affect and provide the regulatory infrastructure that many people have alluded to, thinking about how those policies are structured in a way that incorporates implementation science and can learn from the lessons of implementation science. So recognizing that the details of policy matter, that the politics associated with the rollout of these policies matter, and thinking through not just what we want, what our end goal is, which is oftentimes what we do with regulation and legislation, but encouraging our policymakers through dialogue with communities and other agencies and stakeholders to think through what the steps involved in getting to that end goal, and how policies or program initiatives or initiatives that come from the private sector can be more thoughtful and deliberate about how those end goals are achieved as opposed to just sort of reaching for those goals. So that's the big lesson here in my mind with regard to implementation science, is breaking down that process of getting to the goals and being very deliberate and strategic about how to get there so we can get there in a way that's efficient and effective.
So she just told us the path. Let's go through a couple of major challenges that are out there and use that approach with job displacement. So Nancy's put a tax that we're going to all go to education. But let's go down, we'll start with Keisha this time. But using that approach, we kind of know where the end point is. What are the different steps that we're going to need to take to potentially get us there? And I'll just say, I think that technology comes and disrupts our society all the time. What's interesting is we have a horizon now. It's not happening tomorrow. It's happening fast, but it's not happening tomorrow. So we have to go from conversation and what we'd like to see to figure out what steps we take. What could some of those steps be?
I think one step is to engage with workers in a real way. I remember I was very fortunate to have trained here, and Sue Baker, and very early on in my training, said, you know, when we think about preventing workplace injuries, the best way to learn how to do that is to talk to the workers. They know how they're getting injured. They know how to stay safe. And I think that we have a lot to learn. You know, I have been very fortunate to work with the private sector, but I know many colleagues don't have those connections. And so how can we actually have further and stronger collaborations with the private sector, talking to workers, talking to unions, and having really candid conversations that will help us get from the conversation side that Shannon mentioned to implementation, to say this is coming, how can we adopt this technology in a way that will achieve the goals of optimal safety and health and also minimize potential harms and risks and dangers.
Beyond the tax.
Yeah, no, I actually was thinking something very similar to Keisha. I think that, so I want to repeat that in a slightly different way and maybe add one subsequent piece. So I think going and talking to the people whose jobs are threatened and asking for ideas, not asking for how do you feel about this technology, but asking for ideas would be really informative. And then to go back to the technology innovators and share the ideas. See what they could do.
Great.
It will sound as if we coordinated this ahead of time. But I was thinking, could we not only ask them for their ideas, but could we do some kind of skills inventory? What are the skills that you rely on as a municipal bus driver or a truck driver or a taxi driver or a parking lot operator, right? There's a certain resistance to stress. There's an understanding of spatial relationships. How do we map those skills onto emerging job categories so we can start to think about the skills augmentation that might be valuable? And could we fund a pilot for, that one city pulls in some voluntary number of taxi drivers and says, would you be interested in a skills assessment and some projections towards retraining? I think that would be incredibly powerful if we and I think what Keisha and Nancy's premise is if we treat them as valuable sources of information and people with valuable skills, as opposed to people who technology is making redundant.
Yeah, so just to add to that, I'd say a couple of things. One is, Jennifer gave a great example of how there's going to be new opportunities in the workforce. So I think we need to be very thoughtful about what those opportunities are. And I think there are going to be opportunities both in terms of the types of new jobs that are going to be created. But I would also say that, if all goes well, and I think we're given license to assume that things will go well in these scenarios for the most part, we'll also have new resources, right? So before we got started, I was talking with a friend and colleague, Dr. Shelley Greenberg, who comes to us from the law enforcement community. And one of the very exciting things I think about automated vehicle technology is that we can, in a very real way, imagine eliminating drinking and driving, drug driving. And if we think about all the resources in our society that go toward policing and punishing and rehabilitating and retraining people who drink and drive or drive under the influences of things other than alcohol, that is a tremendous infrastructure that we have set up in our society. Now, there are implications for workforce associated with that, but there are also tremendous resources that we have an opportunity to shift. So on the ride here today, I heard about Kansas and the challenges that they're facing with their public education system. So we all agree that education is a good thing. Imagine if, as part of this shift in society, which is going to mean shifts in sector, losses of job in some sector, we can start to really invest in the sectors that we've long wanted to but never had the resources for. So I think there's opportunities both in terms of new jobs that are going to be coming on, as well as new resources to think about old jobs that we've long valued but haven't yet invested in adequately.
So now that the panel's working toward the job displacement fix, let's take that same implementation science approach and deal with the equity issue. And people are usually identifying elderly, disabled community kids, but it's broader than that. And in fact, Secretary Foxx didn't talk about a lot now, but he is really one of the visionaries to talk about how transportation's often divided communities as opposed to unify them. So again, we have this blank page that we can create it the way we want to. So again, with this approach, let's tackle equity. Give me your top 3 or whatever else ways that you think we could actually move some actions toward getting that endpoint equity we'd love to have. Can we start? Yep, Shannon?
So maybe I'll start, and this is just top of mind kind of response. But again, looking at the data and looking at the communities that are most affected. And if you do that, one of the communities that really can't be ignored is the Native American community in this country. The rates among our population, our Native populations, are unacceptable. Really high, far and above what national averages are, far and above what other communities are. I have not heard discussion of our Native communities in this dialogue, and there's a real opportunity there to provide technology, to provide system support in a way that, boy, could make such an impact on a community that is too often ignored in our country. So that's one place that I'd start where the data would lead us.
A metaphor that I would like to sort of operationalize is that we now understand what it means to have communities that are food deserts. Can we take a notion of a transit desert or a transportation desert and put out RFPs and ask companies to be partners in solving that transportation desert problem? And what's interesting about this to me is that when we think about autonomous vehicles, most of us are thinking about things that are more like cars, but there's a variety of emerging forms, right? There's motorized bicycles, there's sort of motorized scooters. How can we use the breadth of forms that are emerging to solve the transportation problems that we know about and those that we don't know about, and just start to go to ground in these neighborhoods where people have really appalling and frustrating and career-stifling commutes, and make that absolutely an urgent challenge to be solved and sort of organized. Whether that's something analogous to another smart cities challenge, or a kind of multi-city RFP. If these technologists are saying that they are tackling the big problems, give them a big problem and say, we invite you to engage and disrupt the transit desert.
So I love the transit desert idea. I absolutely had not thought of that. I do want to build on where you ended and was thinking something similar. So I'll start with what I said in my answer to your first question, which is I want to go back to making public transportation free. That's one thing I would do in the name of equity, in the name of all sorts of other incentives that I think are aligned through that kind of intervention. I think, so I also want to go to having challenges for cities and also for rural communities, because a lot of these people are not living in cities. And of course, to get there, you have to have enough political will to recognize, to believe that equity ought to be a goal. And I think that's a challenge we live with in the United States. I mean, I was sort of like drooling listening to the talk about Sweden. And part of what seems to be the cultural political will and commitments to the well-being of all, and that of course is a responsibility of government. It ebbs and flows in the United States with who's in power, but it's never, I think, a core commitment the way it is, I think, in some other countries. And yet, if there is an opportunity to move the needle on that, I do think that pilot projects can make a big difference, because I don't know what the answer is, but I am convinced that if you get a bunch of different people and smart people in the room, there will be answers and there will be ideas, and they need to be tried, and that some of them are really going to make a difference.
My answer may sound like we coordinated again. I mean, very consistent ideas. You know, I think equity can be a goal for policy change and for decision making. I think we can get there. The literature around transportation equity suggests the types of things Jennifer was talking about regarding sort of transportation deserts. I think that we can do a better job of reframing sort of what public transit is. You know, I think about, I grew up outside of New York and rode public transit all the time and subways in New York, and I remember moving here to Baltimore, the perception by many people was, you know, I took public transit because I couldn't afford a car when I was here. And I think that's just the wrong way to think about public transit. You know, in cities where that's the thought, only people who can't afford to own a car take it. Well, why can't we have a society where public transit is a great source of a means to get around? You think about the potential of public transit being amplified with autonomous vehicles, and sort of thinking about technology in a way to sort of get us around where it's the cool thing to do to ride public transit. And I also think about rural communities that are completely, in many areas, absent of public transit opportunities. I spent a lot of time this summer collecting data for a project in places where we had to drive everywhere to get around, where people talked about not being able to access parks and playgrounds for their kids because they couldn't find the bus, or the bus would take too long to get them there. I mean, these are major challenges that affect where we live, where we work, where we learn, where we play, where we pray, and I think that we can do a better job of being intentional up front and thinking about these equity consequences before we make these decisions.
So, crystal ball, what do you think's the biggest unintended consequence that's out there related to this new technology and the changes in our transportation, society, et cetera? It's not fair, because if we knew it would be, yeah, but
Right.
From your perspective, and we'll start with whoever's ready.
Because it's not my area, I feel free to charge right in. I would worry about the slothification of that people will choose not to walk if they can just easily get into a pod. If you have, you know, mobility as a service, and you can, you know, that a walk of half a mile to 3/4 of a mile will no longer seem sustainable, and that we will be training up children because it will seem so much safer, right, to put your 9-year-old maybe in a pod to go 2 miles to a friend's house rather than having your child have a sense of freedom of the streets. So I worry about the public health and obesity implications of that.
Yeah.
Yeah, maybe sort of along those lines, perhaps an unintended consequence, maybe not the biggest one, but one that I think about is isolation. So we've certainly seen changes, I think in recent times with regard to technology and personalized technology, and how, our teenagers or young children interact with one another these days. And there's less face-to-face communication. And I wonder what the implications for us as a community of people are in a time when what we're talking about, having personalized technology readily available, will do to us as social beings, and the implications for that on our culture.
I'd like to just highlight two things that came to mind. One is the potential to exacerbate the already existing racial and ethnic disparities we see around crashes, right? So if this technology isn't rolled out in a way that promotes health and is equitable, we think about the disproportionate risks to our tribal communities. You can imagine that those differences could grow if they are not, those communities or other communities that are disproportionately impacted are not afforded the same opportunities that wealthy, educated individuals are. So that's the first thing. The second thing takes me back to something Matt said earlier in his comment on Vision Zero. You could imagine, he made a comment about if you have sort of a rotary, maybe you'll have more crashes, but the speeds will be slower, right? So fewer people will die. And I would hate for somebody to look at the data and say, this isn't working, right? There's more crashes. But at the end of the day, if the goal is to reduce death or severe injury, and we're seeing that, how do we balance that with the data that might show that as people are learning that we might have more crashes, and just being mindful not to jump to conclusions too early about things that aren't working, and really taking a step back to think about what are the overall goals for public health up front as we roll out this technology.
Well, I guess if the question is unintended consequences, I mean, I don't disagree with anything that anyone else has said, but I do think that the two risks that I feel like we've talked about a lot on the panel of job loss and a heightened growth of disparities are there. I will go with the assumption that neither of those is intended. But I think they're significant, and I think that if we I love what you said about we're in this window now where we have time, and I think the challenge is how to engender again the political will to address those, because there are strategies for both of them, but they're hard. They're hard, and they build on job loss and inequities that pre-existed autonomous vehicles that we haven't really figured out. So, but I think I see those as the two biggest, clearly unintended consequences.
So what is the biggest challenge ahead, and what do you think is the biggest benefit of all this new technology for our society? What's the biggest challenge? What's the biggest benefit? Shannon, can we start down there?
Sure. So the biggest challenge, I think, is the one that we're grappling with today, which is how to do it well, how to do it right. And I don't think that path is clear yet. But I'm confident that we can get there, provided we're deliberate and thoughtful about it. But that, from my perspective, is the biggest challenge. Biggest benefit. Change is good. And this is about tremendous change. And if we do it right, the benefits are there's so many benefits. It's hard to quantify or hard to sort of pinpoint just one. So I'm going to cop out a bit in responding to that one. But there's tremendous opportunity.
Great.
So from where I sit, the biggest challenge is the capacity constraints of cities to make the best decisions they possibly can, and those capacity constraints take two forms. One is just city residents, like all public servants, or not city residents, city officials, like all public servants, have to balance between, dealing with the pothole, the crash, the demands of the streets today, and that limits their ability to imagine what can be in the future. And second, there is a real preemption threat at not only at the state level, but also at the federal level, that cities will not be able to respond flexibly and creatively and help us and be places where we can actually learn about the implications of this technology. So that I think is the biggest threat. The biggest opportunity is a significantly improved, a magnificent public realm. If you think about how much space the average city or suburb or rural area gives over to cars, it's kind of staggering. And if we take full advantage of this technology and move to kind of a fleet model and away from an individual ownership model, we can reclaim so much of our street space, so much of our curb space, so much of our driveway space that will have implications for construction costs, that will have implications for kind of intelligent densification, because we won't be turning over so much room to parking. And we could have a richer, more gorgeous, less polluted, more humanly amenable public realm, and that is that would be a gorgeous benefit that of the kind that Shannon was describing.
Yeah, again, I agree. I think that the biggest challenge is that the timeline and the agenda will be driven really disproportionately by the manufacturers. And all that we've been talking about are all of these societal issues, and I think that there will be attempts to respond to really in the weeds challenges rather than the big societal ones, because that's what we need. I mean, it's the equivalent of the pothole, but even in the context of autonomous vehicles. The benefits are, the potential for benefits are tremendous. And I would say through this combination of more narrowly what, we're all public health people, right? I mean, the opportunity to prevent the morbidity and mortality of car crashes is huge, huge, huge. And then everything else that comes along with that sort of dream of being able to get where you want without having to, sort of with all these Jetson kind of things. So I think there's I think there's lots of opportunities, not just for sort of public health in a narrow sense, but again for well-being and be able to get around. But I'm concerned about the agenda and timeline being driven by the people who are making them and can make money from them.
Everyone who knows who the Jetsons are, raise your hand.
Yeah. Yes. My kid's favorite music is the Beatles. That's a good thing.
In addition to the challenges mentioned by my colleagues, I would just add the data and data sharing. And I think Jennifer talked about cities sort of wanting that data and not having access to it. So how can we think about data sharing between manufacturers and other systems, and really allowing people to look at the data in a way to target opportunities to those who are disproportionately affected or just other needs for data. And in terms of the benefits, I'd say there's a tremendous potential in what I'll say is the 37,461, right? The number of people who died in 2016 from crashes. The potential to reduce that number significantly is what gets me excited about this technology.
So, Nancy, you set this up in this question. If you want to say you answered it already, we're fine. But we're here at the Bloomberg School of Public Health at Hopkins. So for each of you, before we go to the audience with some questions, where does public health fit into all this? Where can it play a role? Where can it add value? Where do you have your own challenges? Sort of give us a quick, how do we articulate why public health shouldn't just be in the discussion, but should be part of the leading edge of making this happen the right way?
So am I starting?
You kind of just gave an answer about that, but if you'd like to elaborate.
So I'll give a narrow and a broad answer. The narrow answer, it's a public health issue for the reasons that Keisha was just saying, right? We are in the business of thinking of ways to prevent significant morbidity and mortality, and boy, this technology can do it. I mean, this is a win like very few other interventions in public health can be. So that's what I'll call the narrow sense, and that is completely our business in public health. We also in public health think a lot about social determinants. And so if we are not mindful about the social context in which this is being introduced and the way in which this could have a positive or negative impact on the other social determinants that predict health outcomes, we could have an unintended consequence where more deaths are generated from the inadvertent social effects than were averted through the crashes. And that's something we in public health, along with many, many, many partners, could be at the table to think about.
Jennifer?
So I'm not a public health person, but I appreciate the value that public health can bring to city deliberations about this. First of all, because I think public health people will help keep equity on the agenda, whereas sometimes, when you look at city government decision-making, efficiency outweighs other concerns, so I think public health is a strong voice for equity. And I also think that public health, particularly in its epidemiology manifestation, can help cities be smarter about data and help them better understand the kinds of patterns that they need to address and help them develop the sorts of rubrics and structures to explain what's happening and maybe can play an important communications role. Because one of the things that I do worry about is, everybody heard about the Tesla crash, right? The guy takes his hands off the wheel and he crashes into a semi, and so people say, these aren't safe. No, I'm not safe, right? Humans are better drivers than squirrels, but we're terrible drivers. And I think helping cities kind of be able to understand, the difference between the signal and the noise is something that public health can help sort of put into perspective. And as Keisha says, keep that 37,000 number really in front of people and say, yeah, there will be some crashes, but we're talking orders of magnitude of change.
So why public health? I would say on a very fundamental level, what we prioritize in public health is what people all over the world, regardless of where you identify professionally or personally, value: health. The work that we do typically looks at problems while they're happening in society, analyzes the data, and comes up with fixes for those problems. We're in a very unique and fortunate position with this technology right now to position ourselves in collaboration with our partners on this issue to not wait for those problems to happen. I'm very excited about the forward-thinking nature of this conversation today about our future role in this space. To think about, 10 years, 20 years, 30 years from now, not getting the 37,000 number, not having work to do with regard to injury prevention in the transport realm. That's what we bring in a very real way. And I'm incredibly excited about engaging in that journey.
And I'd like to add that for me, public health is so central to this discussion. From my perspective, it's sort of a no-brainer because transportation is a fundamental determinant of health. Transportation matters for how people access goods and services, impacts our built environment in terms of people walking and biking, provides jobs for individuals, and it's just so central. And so to have a conversation about the future of personal transportation and autonomous vehicles and not think about public health that doesn't work in my mind. And so as we sort of think about it, I think there's a central role, and those of us in public health, though, I think need to do a better job of reaching out to our colleagues in the transportation sector and in the planning sectors to really identify those common goals and the mutual benefits that working together could have as this type of technology rolls out.
Great. So we have about 10 minutes for questions from the audience. And they've been brilliant about keeping to their time, et cetera. And do we have a microphone or? Thank you. Great, we'll do a microphone. And all I'm going to ask is, having been raised in a PhD environment, you don't get any slides. So keep it direct and crisp. And let's start with the gentleman right there for the panel, please. Just tell us who you are. Well, this is being streamed live, so if you could.
I'm Art Cohen. Art Cohen, a earlier graduate from this school, and I'm a public transportation advocate. I noticed that there are two elephants in the room that have been discussed in passing. One is the producers of this technology driving what's going on right now, and I think that's important. There's another very important one, and that is the insurance industry. The insurance industry's bread and butter right now are auto policies. On the other hand, I remember going years ago to an American Public Health Association meeting at which Louis Dublin, who was an insurance man all his life, wowed the crowd by sharing data about suicides and automobile. And so this data question, I just think that to get this done right, you're going to also have to address the insurance companies. And they are a tremendous repository of data as well.
And is there a specific question, or did you want to just raise that as an issue?
Well, I just want to make sure that it's recognized that the insurance companies are, I mean, they're a major part of our economy, just like the automobile is.
Mm-hmm. So if anyone who would like to make a comment just about, there are a lot of players here. Insurance companies have not been mentioned yet. Anyone?
Good comment.
We agree.
Yeah. Thanks for the comment.
Yeah, very important. Yep.
He let you off easy. I was looking for that question that would get you going there.
Hi, yeah, I'm Amitai Benon from Securing America's Future Energy. I lead our autonomous vehicle program. And I think what I'm hearing over and over again from the panel is that every time there is a public equity that is involved and it's going to be accomplished through a private sector technology, there's going to be some sort of need to bridge that gap and use public policies to induce private sector actors to act in a way to address that sort of equity. And I think in the autonomous vehicle space, that problem is particularly thorny, and it's because the amount of capital that's flowing through autonomous vehicle developers. Brookings recently estimated that number is approaching $100 billion. So when companies that have that scale of capital involved in their decision making, they're making decisions based on their investments, and we're already seeing in practice states like Arizona are attracting a lot of activity, not because they tied public equity goals to deployment, but they said, companies come and just deploy as you want. And we've worked with many cities who have tried to tie public equity to some amount of funding, and we've found that the amount of funding that a local government can reasonably offer is really not effective as a carrot to induce some of the major players in the space to act specifically in a way to address public equities. Rather, they're addressing the problem of how do we get our technology out on the road as quickly as possible and scale. So, do you have any thoughts about how we can begin to bridge that gap? Or strategies for trying to, accelerate the conversation towards the equity side rather than necessarily, return on investment.
So I'll start quickly. One of the things that we've thought about using as a tool, and it's really hard to orchestrate, is seeing if you could do like a multi-city RFP, because one city, if one city is in negotiation with Waymo, for example, Waymo can easily leave and say, well, Austin, you're making us do things we don't want to do. Fine, we'll go to Houston, or we'll go to, Phoenix. But if you had a multi-city pilot, right? If you had 6 or 7 or 8 cities coming together and saying, we are explicitly looking for an equity solution. What can you provide us? That may be more powerful. What you could also think about is looking at smaller players in the market to at least give you some initial outline of how you may want to create a regulatory regime. So to think about what happened when Uber and Lyft left Austin because of an ill-considered referendum that they themselves put forward. When they left, a lot of smaller ride-sharing companies were able to flourish in Austin. Now, when they came back, a lot of the smaller companies shut down. But this is not a monolithic kind of. It's not quite in the situation we are with the OEMs that there's only 3 major players and that's it. So I think you could see maybe a more variegated environment where smaller providers might be willing to run experiments. Something like a Local Motors, could help you solve some equity things and allow you to set some better parameters. But yeah, it's really hard. Nobody wants to do equity. That's why government has to be the guardian of equity.
Yeah, that's exactly right. You've illustrated with that $100 billion number what the power imbalance is here. And so it seems that short of cities joining forces, I mean, almost, I will use this as an expression, I don't mean literally, unionizing, right? For cities to band together and say, this is what we stand for, and we think it's a cool idea, but under the following conditions. Where there aren't enough alternative places for the companies to go, do they start to exercise some kind of power? It won't be financial power, but it will be power that ends up being essential to the companies who need to test their vehicles. The other thing, and again, this is beyond my expertise, but I could imagine if you get creative people in the room, maybe there will be some market incentives for the companies to bill themselves as doing the right thing. And image is not irrelevant. It's not the driving force behind the technology by any means, but being the company that in a real, these are going to be so expensive when they roll out. And there are people with a lot of money who really care about a feeling of doing social good. And if it turned out that there was a particular company that marketed itself as a company that cared about social well-being as part of its mission, and every city they went into, they did the following 3 things, might be helpful.
It could almost be like a Tom's Shoes model, right? One ride for you, one ride for an underserved person. The creative people are gonna find a way.
So we have time for one more question. Let's go to this side of the room if we can. We have
at the microphone.
Yep.
I wanted to say I'm happy to see 411. I couldn't let the day go without saying that. Sorry, after all the things happening. So kudos. I'm here in a capacity. I work for Baltimore City Department of Transportation, and I was invited by Dr. Pollack. But part of the things I wanted to mention is the technology and impact on disparate populations. I think to kind of ask a question to you and maybe just in general making a statement, I think the equity component needs to be built in at the beginning. Transportation is a greater good industry, and I think that yes, the books are important, but I think when you're trying to do the right thing by creating an equitable way for people to get around and also making a paradigm shift of people who have to use transportation versus people choosing to use transportation, how do you address that? I mean, because policy making and regulatory efforts are behind because technology is moving so fast. So how do you address that? How do we deal with it? And how do we, quote unquote, as you said, unionize and empower cities to play catch up to technologies that are kind of beating them to the punch? I mean, you have autonomous vehicles, you also have dockless bikes, and you have things like that that cause a lot of help for people who are in disparate groups to get places that they couldn't get to with first and last mile access. But then you have the challenges that they still can't afford all of the other things to go along with that. So how do you think that we could address that?
I'll just jump in. Thanks for that question, Veronica. Just a couple thoughts. One is, I think that we need systems level change, right? I think exactly what you said. How do we build in health considerations, equity considerations up front? I think there are a number of localities around the country I can think of that are doing this in sort of a more regular way, where they have really, I don't want to talk about the sort of catchphrase of health in all policies, but there are a number of cities that really have adopted that as an approach to decision making. And we see sectors coming together. We see intentional discussion and open discussions around equity issues, around health issues. And I can think of several places that you see these conversations, particularly with transit and transportation individuals who are raising those equity issues along with the health folks. I feel like as we start to see, there are more schools now of transportation engineering where they're learning about equity, that they're learning about the concepts, they're learning about community organizing and power and issues that were not part of the curriculum many years ago. So I think we're starting to see that, and as we have the sort of new people coming into those fields, they're thinking about those areas in a more intentional way than we've seen before.
So we're going to wrap this up. Shorter is harder. So I need one line from each of you to close this out. One line from each of you will go right down and we'll be done. So whomever would like to start, one line. What's the thought, parting, whatever you'd like?
Give you one word.
Even better if you'd like.
Partnerships.
Great.
Asking the people who are most affected by the decision making and making sure that they're at the table.
I'll give you the last word, Keisha. What we've been talking about today is completely within our grasp.
and I'll leave everybody with 37,461. We have great potential to make a difference there.
Nice.
So this, because we got to acknowledge this, which is, this is a very unique forum that's going on here today. This panel, thoughtful, provocative, and we can't thank you enough for what a great job you did. So please, let's say thank you.
There we go. Great. Well, thank you to Mark and to our outstanding panelists for that most engaging conversation. I'm delighted to introduce our final keynote speaker, Kass Sunstein. He's an American legal scholar with expertise in many areas, including in law and behavioral economics, which he's going to talk about today. He served as the administrator of the White House Office of Information and Regulatory Affairs in the Obama administration from 2009 to 2012, before which he taught at the University of Chicago Law School for more than 20 years. Today, Kass is the Robert Walmsley University professor at Harvard Law School, as well as a prolific writer, of course. And I'm sure you're familiar with many of his books, in particular, Nudge, Improving Decisions About Health, Wealth, and Happiness, and two recent books, The World According to Star Wars, and #Republic, Divided Democracy in the Age of Social Media. We're just honored and delighted to have Kass Sunstein join us today, so please welcome him.
Thank you so much. It's a complete thrill to be here, to see friends, and to engage on an immensely important topic. So the Nobel Prize for Economics was just given a couple days ago. If I'm a little jet lagged because I got to be there, and it was given for behavioral economics, which to Richard Thaler. And this area, it's a little like, I think, an 11-year-old, in the sense that the theory is pretty well developed. The theory is in its maybe late 20s, but the applications are very early, and they are very rich for this topic. So two preliminary notes: the Guidance 2.0 released by the Department of Transportation. It's superb. It's a fantastic foundation for progress. There's a pivotal section about driver-machine interaction, where the question is, if the driver actually needs to be engaged, how exactly does that work? And in some ways, the discussion is a placeholder for what needs to be developed. And here's the kind of behavioral problem. If you're in an automatic vehicle that's self-driving, the likelihood is that your attention will be focused on your spouse, your job, your favorite sports team, and not on the operation of the vehicle. And if the vehicle needs to get your attention in order to avoid something bad, the risk is that's going to be quite challenging. And the starkness of the risk is signaled by the fact that as many people as die from opioids in the United States, and it's in the tens of thousands, nearly triple that number die from a failure to adhere to medical compliance with, say, take your medicines every day. That's 128,000 unnecessary deaths, and that's because of a problem of lack of attention. So that's one focus where we have something to learn and some clues for solutions from behavioral science. Here's another bit of research that I've recently been involved in completing, and it came up with a very surprising result. So the theory, which is very relevant to this topic, is that for a range of decisions, human beings do not want to choose. They want to choose not to choose because they want to devote their attention to the things they care about, and hence delegation to a trusted other is welcome. To test the truth of that conjecture, what we did was to get a bunch of human beings to undertake a task in which they could tell in real time how good their own performance was, and this is for real money, so it's incentive compatible, for real money to see how their performance is, and also to see how a potential delegate is performing on the same tasks where the potential delegate is an algorithm. And they can see in real time their performance for money, and they can see in real time the performance of the algorithm. The hypothesis was that people will rationally test whether their own judgments are better than that of the algorithm, and whether they will delegate to the algorithm will basically depend on who's better at the relevant task, which is a simple kind of arithmetic task. And the hypothesis is that people will delegate for economic gain, or if anything, they will delegate a little more than would be expected, because what matters is conserving your mental energy as well as making money. The hypothesis was falsified. This is not what happened. People were keeping good track of their own judgments. They were not on this task overconfident. They were accurate. Even so, they were willing to lose money to maintain control. So the hypothesis was falsified, and the reverse hypothesis was confirmed, which is that there is a control premium such that people will relinquish something they care about, money, even under circumstances in which they're clear that they're going to relinquish something they care about, money, to maintain control. Now that's in a quite boring task, kind of arithmetic. In a task that involves driving, it's possible that the control premium will be heightened, partly because people kind of like it, and partly for reasons to which I will return, people show overconfidence. Okay, so what we are learning is a lot about how people think and act, and these concrete findings bear both on the question of rollout of vehicles for which people have less responsibility, and on transition issues. So what's happened in the last 20 years is that a poem and a prayer, it's almost a haiku. At the University of Chicago, it's a prayer. At Harvard, it's a poem. It says human beings are rational. They calculate probabilities and maximize expected value, and they respond to incentives. And that idea plays a role in road safety policy as well, and the policy prescription is to improve incentives, where the incentives may be economic, they may be health-related. It's not a terrible poem. Well, as a poem, I guess it is a terrible poem. It's not terrible social science, but in many domains it fails. And the basic clue to its failure is kind of summarized in work in behavioral science, which says that there are two systems of cognitive operations in the human mind. The first is system one. It is automatic and intuitive and fast. When it sees a large dog, it thinks, oh my God. When it feels a shaking plane, it thinks, I am going to die. System two is deliberative and calculative and slow. And system two, which is the harder to trigger, is the more accurate one very frequently, in the sense that it runs numbers and it doesn't get scared or go wrong because of a flash of intuition. I have an 8-year-old boy, and like any good father, I explained to him the difference between system one and system two. He insisted on calling them part one and part two for about 6 months, And the reason the parenting required this intervention was whenever he passed a store that had toys, he started thinking, must go in, must go in. And I said, your system 1 needs the toys. Your system 2 realizes you have more toys than you need. And this has worked at times, but not long ago, he looked at me and he said, Daddy, do I even have a system 2? I wasn't quick enough to point out that he wouldn't have asked that question if the answer was yes. But it is exemplary of, I think, driver behavior, where System 1 is running the show. Okay, the behavioral objections which particularize these findings are that human beings have limited attention. That is, and there's a whole book produced by the Department of Transportation on limited attention insofar as it affects drivers. People show present bias in the sense that today really matters, next year not so much. People don't deal very well with issues of probability. They can be unrealistically optimistic, and they are loss averse. And these are all highly relevant to what we're discussing today. For a little more detail, how many of you have seen the movie of The Invisible Gorilla? Okay, less than half. This is a little film, you can find it on YouTube, in which the task is to count basketball passes from players who have white shirts to players who have black shirts back and forth. And I was a participant in a invisible gorilla experiment involving about 30 Harvard professors. And after we failed to count the passes but tried, the experimenter said, and did you see the gorilla? I remember my own reaction was, of course not. This isn't a gorilla. There wasn't a gorilla there. What kind of trick is the experimenter pulling on us? One member of the group raised his hand and said, I saw the gorilla. And I thought to myself, this is a confederate of the experimenter, and there's some fiendish thing happening. Then the experimenter said, try the film again, and don't count the passes. And sure enough, halfway through the film, there's a gorilla, human being dressed as a gorilla going like this. It's plain as day. And yet 29 of 30 participants in this study missed the gorilla. Now, often features of driving situations are like gorillas. You don't see them because you're focused on other stuff. And the limited character of human attention is a primary source of deaths on the highways. Okay, there was a time in New York recently, and I was living there, when people were terrified of dying of Ebola, such that public policy was shifting in the direction of Ebola prevention, even though at that time more Americans had married Kardashians than had died of Ebola. And people were not saying, oh my God, I might marry a Kardashian. The reason for the inflated fear of Ebola was there was one death, it was highly publicized, and it drove up probability judgments. So a behavioral finding, which actually produced a Nobel Prize in 2002, is that people use the availability heuristic to assess probability judgments, and that may mean that in the case of a highly publicized driverless Uber car involved in a crash, there can be terrible effects on public judgments. We know that people are typically unrealistically optimistic. 90% of drivers have been found to believe that they are safer than the average driver and less likely to be involved in a serious accident. 100% of people, I believe, think that they have better senses of humor than the average person. And 94% of professors believe that they're better than the average professor. This can be a terrible obstacle to humility with respect to safety issues, and it can distort judgments about whether change is good in this domain. Okay, the problem of unrealistic optimism is connected with the illusion of control, which I think is connected with the control premium, where people believe that they have mastery over a situation, especially if in some sense they retain agency, even though control is limited. Those in the room who have been involved in a crash in one way or another are probably able to use the availability heuristic to recall the literally devastating capacity of the illusion of control. Okay, so 6 behavioral policy claims emphasized since basically 2005 are default rules really matter, incentives may not always matter much, choice architecture is really important and not avoidable, people can use a nudge, and simplicity is very important. What the guidance 2.0, the excellent guidance 2.0 is missing, I think, is a specification of how the challenges of driver-machine interaction can be met with reference to stuff like this. Though stuff like this, and I'm going to give some details outside of the context of automobile safety, there needs to be some work to figure out how the application works. Okay, so we know that automatic enrollment, which is to say default rules in the context of savings behavior, are massively effective. So at every end of the income distribution, automatic enrollment in a savings plan dramatically increases savings. And what's noteworthy here is even for people who are making $100,000 or more a year, if they're automatically enrolled in savings, participation rates increase dramatically. So the question is, what kinds of default rules would be usable in the context of automobile safety or in the shift to self-driving cars that would alter people's perception of what the default is? That can be massively important, and there's a paper just posted on the internet yesterday which shows that people of great sophistication, including managers and people in significant positions in business, have no clue about the power of default rules. So notwithstanding the fact that the default rule is the gold medal winner for nudges, this has not penetrated the consciousness of people who are in the business of designing default rules. This is the FAFSA form, that is the financial aid form, and the complexity of it is a tribute to its imperfection, let's say. This is the flow chart, not the form. And the fact that many Americans who are eligible for financial aid aren't getting it is because of this. And this is a warning sign in the domain for this conference. Okay, a GPS is a nudge in the sense that it is respectful of people's judgments about their own preferred destination, but it simplifies their means of getting there. It is choice preserving, and at the same time, it is steering. So it's a form of libertarian paternalism. It preserves freedom of choice, but it also has a steering function. In response to the invisible gorilla experiment, the Netherlands airport designed its urinals in the following way. The women in the room may not have seen a urinal before. This is what it looks like, at least a part of it. But not every urinal has a fly painted in the urinal. This one does. And the reason for painting the fly was to attract men's attention to where to aim. And the result of the painted fly was to reduce spillage by 44%. Apparently, men can't help but aim at the fly. And there are contexts, aren't there, where for more serious, even, public policy problems than spillage at airports, it's hard to imagine there are many more serious than that, but more serious ones where we can do the equivalent of painting the fly. And I hope that's triggering some thought. A friend from Germany sent me this. It's apparently a real postcard in Germany. And I can't read German either. You see the problem. Okay. In the United Kingdom, there has been an attempt to attack the problem of overprescription of antibiotics simply by notifying doctors that their prescribing behavior is in the upper decile of the distribution, and that notification that they're departing from the social norm reduced by approximately 70,000 the number of antibiotic prescriptions in the first 6-month period. So the suggestion is signaling the existence of an emerging or entrenched social norm can be extremely effective in altering behavior. It's often a really powerful nudge. Okay, this is a redesigned cafeteria that basically has the healthy stuff at the front, and that is extremely effective in reducing caloric intake. Okay, so what we're talking about is a feature of the social environment that affects choices without imposing coercion or any kind of material incentive. Here are three ideas that I hope will trigger thought for road safety. Automatic enrollment in savings plans has a much bigger impact in promoting savings than significant tax incentives. That's data from Denmark. Now, I confess that the issue of retirement savings isn't, to me, the most gripping issue in America today. So what's important about it is not the interestingness of the context, but the underlying behavioral dynamics, where tax incentives ought to have a big effect. They don't. Really small effect. Automatic enrollment ought not to have a big effect because people can obviously opt in under non-automatic enrollment, and they can, of course, easily opt out under automatic enrollment. Nonetheless, automatic enrollment is the winner. So use of automaticity is often valuable. There's a company called O-Power. I think it's changed its name. The new name's less memorable, so let's call it O-Power still, which sends reports to people telling them how their energy use compares to that of their neighbors. And the effect of the home energy report, as it's called, is larger than the effect of significant price increases. Now, that's worth pausing over. The data is that the effect of the O-Power letter is equivalent to the effect of an 8 to 20% spike in the short-term cost of electricity, which is suggesting that knowledge of what the social norm is extremely impactful in altering behavior in a domain in which you might think that behavior is tenacious. It isn't that tenacious once people see they're departing from the form. Simplification of the financial aid form, which you saw the flowchart to before, has the effect equivalent to a several $1,000 increase in the educational subsidy. So two policies: simplify the form, uptick the financial subsidy by $2,000, same in terms of college attendance, which suggests the massive importance of simplicity, of making things easy as a strategy. I'm thinking that that has implications for this domain. I'm going to tell you a little tale that I found like a sunburst from Nobel Prize winner Daniel Kahneman, who was speaking at the White House about behavioral science, and recalling, he thought, the immensely important research done in the 1930s by a German psychologist named Kurt Lewin. I'd heard of Lewin, I hadn't heard of this work. But the work suggests that there are two ways of changing behavior. One is you give people a little push in the direction through maybe an incentive or a penalty or suasion of some kind. And the other is to find out what is the obstacle to their doing the thing anyway and taking away the obstacle. And Lewin's claim was, in multiple domains, other things being equal, obstacle removal is the preferred strategy, the more effective strategy. And you can see automatic enrollment as basically an obstacle removal strategy. And the home energy report, it turns out, has that characteristic because it gives you a few simple tips. So one question here is, what are the obstacles to the adoption that is sought? And how can those obstacles be removed? Okay, 10 nudges. I think I'm just going to call out one of them here, which is reminders, where we are finding that reminders are immensely impactful. They're like the painted fly, and they make the gorilla visible. And on this list, I'm going to make just call out the uses of social norms as a strategy for behavior change. Okay, I'm going to give you one final example of an intervention which seems to be successful, and a slogan I had in the US government, which was plate, not pyramid. An obscure slogan. This is the food pyramid used by the USDA for many years as a way of encouraging better eating. There's a person, gender unclear, you see the person? Can't tell if it's a man or a woman, shoeless, marching to the top of a pyramid. Can you figure out what that little white triangle at the top is? Is that death? Is it thinness? Now imagine you're a teacher or a parent or a high school student figuring out what the government thinks you should eat. Do you know what these colors refer to? I work on this stuff. I have no idea. Do you recognize what the foods are? Can you see what the foods are? There's only one that's clearly recognizable. If you look very closely, it's on the bottom right. That's a shoe, isn't it? Is the government saying eat the shoe? Now, the food pyramid was frequently criticized on the ground that it was unhelpful and that resistance was a product not of people's disagreement, but of the incomprehensibility or unnavigability of the guidance. So this was replaced by the food plate, which basically makes extremely clear what you're supposed to do, which is make your plate have fruits and vegetables. The best book I know on software design and website design has a great title. It says, "Don't Make Me Think." And the basic idea is for a website to work, it has to be just super easy to navigate. And that's maybe instruction both for popular acceptability and for public use of self-driving cars. Okay, I'm going to end with words from the greatest English language poet of the 20th century, and they're also a nudge. William Butler Yeats wrote, "Do not wait to strike till the iron is hot, but make it hot by striking." Thanks. So, do we have time for questions? Or?
Oh, yes, we have a couple minutes.
Do we have a minute for questions, comments? Yeah.
We need the microphone if we still have it.
Thanks. I was going to ask this question earlier, maybe you can address it. It's in terms of some of the ethics of, okay, we're sort of nudging people to do something, but what is the issue of the natural experiment of using an imperfect technology on actual roads, or having people not educated well enough and use this technology imperfectly? It seems like I'd like to have that addressed somewhat versus what Europe does, which is test it out maybe thoroughly, some European countries, versus testing it on, U.S. roads is what we're doing now.
It's a great question. I'd want to be extremely quantitative. That is, go number crazy. And 37,000 deaths in 2016, that's probably, if we have to keep one thing in mind, that's the most important thing to keep in mind. And if there's an imperfect technology that with, let's say, more data acquisition could be improved such that the likelihood of deaths from its use would be reduced significantly, then by all means do the tests before doing the studies. If the tests would be delaying the rolling out of technology that would dent, even in the short term, those 37,000, then don't delay. So one way to go would be to ask, what's our best judgment based on data of the value of delaying actual road use of the technology? And the word ethics in that context is the good first word, but it's, I think, best used as an introduction of getting really quantitative. If you have questions with respect to numbers, that is, the projections have speculation in it, then there's a judgment about what kind of precautionary approach to take. And precautions can be deadly in this context, meaning to say we're not going to try the thing because we don't know the thing is perfect. That's going to kill people, which suggests the importance of, of getting some of the people in this room to tell us, what's their best guess.
Yes. I guess.
Go ahead.
Maybe I'll take it. Yeah. So we talked a little bit earlier about the billions of dollars that are being spent by manufacturers to in this race to get to level 2, level 3 levels of autonomy. what I think is very interesting is the human factors, and that talks exactly about your topic. So when you look at polls right now, usually you hear that 75% of people want to be in control and do not trust self-driving technology. And yet it seems that there is not much that manufacturers are doing. So I was wondering if you have insight about how this should be done, if and how we should encourage the use of automation, and how about educating people?
Well, the fact that people might be at risk from self-driving cars is alarming to people. What might be helpful is to make salient to them the extent to which they're at risk. The status quo is not acceptable. 37,000 people died. And what's the tragedy of that is the abstractness of that number. Every one of that things is a tragedy. And if it's the case that we have a very serious public safety problem in which we can make a severe dent with this stuff, this is an opportunity, not a threat. And one maybe way to think about this is human beings are loss averse. So a loss from the status quo, a red light goes off in the head. A gain from the status quo puts a little happy green light that's about twice as bright as the sad alarmed red light from the loss. And your poll, I think, is suggesting the power of loss aversion, as it's called, that the losses potentially introduced by automatic vehicles are very salient to people. And a way of addressing that is to point out the losses that the status quo is imposing, so that people aren't thinking, maybe I'll get a gain from this, but who needs that? Life's pretty good. Instead, suggesting the life we save may be your own.
Sure. I wanted to follow up from the previous question. So automakers tell us that consumers don't pay a premium for safety, and that's borne out by quantitative studies that show that when new features are introduced into the fleet, if it's a performance feature, it gets adopted through the fleet relatively quickly, but if it's a safety feature, usually it takes much, much longer for it to achieve widespread adoption. Often that's the result of a regulation. And I'm afraid that that is a potential obstacle for the safety benefits of autonomous vehicles. So I wanted to ask you, what can we learn from behavioral economics to help consumers adopt a new technology that's primarily meant to make them safer?
Well, one thing that works sometimes is to signal to people, I'm thinking now of smokers or alcoholics, not only that the risks to which they are subjecting themselves, but the availability of a route by which the risk goes away. So if you terrify smokers about the risks of smoking, that can help, but it can trigger resistance or a sense of, just hating the messenger. If you tell smokers of the risks they face and tell them of a route they can take by which they can take the risk away, then that's more successful. So to signal to drivers that they're now under, some threat, even if they're great drivers, and that this will take that away, that is something that tends to work.
Hi, professors on the team. One thing I've often wondered about the facially comical statistic in which 80% of people believe they're better drivers than the average is if that is covering up for subjectivity and what counts to be a good driver. So 80% of people could think rationally they're better than the average because they have a different definition of what it means to be good. And if that's the case, does it complicate the ability to nudge drivers to a particular static definition of good driving if their willingness to relinquish control depends on some sense that they're relinquishing control to something that's better than their own particular subjective definition of driving?
Okay, great. The above average effect is so robust across categories that it would be surprising if the best explanation is that people have floating conceptions of what average. When most people say, or almost everyone says their sense of humor is better than average, it's not that they have floating conceptions of what average funniness is. They just think, yeah, I'm funnier than that guy. And so you're right, it's possible that people who say I'm better than the average driver have a different conception than average. But since even smokers have been found to think that they believe they are personally less likely to get lung cancer and heart disease than the average non-smoker, that probably it's a less fancy thought than that. If people think that they are better than the average driver, then to the earlier point, something needs to be personalized to them with respect to the benefits associated with relinquishing control over the operation of the vehicle. And we have some success stories. Now, the grounds for the success are pretty complicated, but in terms of seatbelt buckling and drunk driving, there have been real dents. And that tells us something about the power of social norms as a factor, the sense that you're actually putting people at risk as a factor, the power of habits. So with respect to seatbelt buckling, some of us in the room remember a time when seatbelt buckling seemed kind of odd. Now not doing that seems extremely unnatural and odd. Something's wrong. And you can imagine something similar here. I was thinking a little bit during the earlier presentations that if you ask people whether they wanted to switch from the status quo to the relevant future, there'll be a lot of nervousness. But if people were in a period when your own driving your car was very unusual, would you like to go back to that? It would seem crazy. Why would you ever want to go back to that? And to get people into that kind of mindset would, I think, counteract the unrealistic optimism. Okay.
I have,
First is an opportunity to thank everybody. The entire morning has been just superb and how enjoyable. So I just wanted to make two comments. Andrea said, if you have any reflections, two things. One is we've been walking around the numbers, but part of my job when I was NHTSA administrator was to make sure safety was right there at the top. So let's be clear, starting with 2015, that number is 35,092 lives were lost. There's some NHTSA people here, raise your hand. They know that number by heart. We insisted on that. Why? Because every one of those is a mother, brother, father. You got it. That's somebody you know, you work with. It's a family member. And it's up now, 37,461 in 2016. So for tremendous advances, the last couple of years, we've almost wiped out the advances that we've had over the past 25 years. It's going up. It's in the wrong direction. And what's interesting is we keep banting about this 94% number. That happened when I got there and everyone's like, how big is that number? Give me the number, let's get a citation if we can do it. And what's interesting, and when I was a board member at the NTSB, one of the things we used to always say, you can have safety, you can have blame. Which one do you want? If you want to go around blaming everybody because they were the right, or whatever happened, or you can have safety, which means acknowledging where changes could actually lead to saving those lives. And that's why everyone who says, well, you point to the driver, it's to blame. No, right? To err is human. IOM, Institute of Medicine, did a report, right? And I think that's beautiful. All of us, we got to acknowledge it. We're the weakest link, right? It's not about blame. If you wanted to change this, public health intervention people, where do you go? The big bar. That's where the big bar is. And it doesn't mean we ignore everything else. We got to go for all of it. But I think we got to sort of realize here, whatever technology is coming, it's not going to get drunk, but it's also not going to pick up a telephone. It's going to get enough sleep. You know, it'll be just fine. It tells you what the target is, but we have to get there. And one of the things in this space we have to remember is there's a trifecta opportunity we can't lose sight of. We love to talk about safety, but the mobility opportunity and the sustainability opportunity, which did not come up at all today, is most people are talking about electric fleets, et cetera. We're talking about what we can do for this planet in a way that is not just safety, mobility, but long-term. And then the last part I just want to raise that came up multiple times is NHTSA also did a really interesting report looking over the last 50 years of how much road safety technology has saved lives. and they made a list of 14 different technologies, did an analysis. Seatbelts were at the top, airbags were next. 613,051 lives were saved over those 50 years. We know technology works. What's interesting about the discussion now, and I'm from Silicon Valley, is technology should only be a tool. So it's come up around this, but all of this should be devised as human-centered. Whether it's around the safety or moving us or preserving our planet, it should all be about the human. If you want a place to start of where the focus should be, that's it. I think the difference here is, what we were getting to on the panel, is there's a horizon. We know what the issues are, there's opportunity here. If we want to get the maximum benefits in all those areas, then we can't just keep talking about it. We've got to figure out what the actions are going to be so that we get all of it. Had a really fascinating discussion with someone just the other evening. When airbags came out, big battle about whether they would actually be required in vehicles. And then guess what? Most vulnerable among us, kids were dying with them. So again, never will technology be perfect. We can't wait for that. Saved all kinds of lives. And having been at the agency when, Takata airbag recall started, 40 million plus, right? The thing we want to protect us is actually exploding and killing us, right? We're never going to always have the technology perfect, but it is a new tool. And I bring that up because part of the excitement, at least personally for me, is for all the things we're doing for 50 years, we can't let them go. We got to keep doing them and do them better, but we have a new tool. But we got to make sure that's human-centered so that we, right, as a society, get all the benefits that are out there. And that's why we have to ask these questions. Even more importantly, identify the actions that will get us to what we think are the benefits we deserve in our society. This has been fascinating. I love coming to Hopkins for these because they're always so thoughtful and provocative. So thanks very much, everybody.
Thank you again to Mark, and thank you, Dr. Sunstein, for an extraordinary talk. I hope some of our speakers will be able to stay for a little bit outside of the room, but we are in need of leaving the room by noon. So I just want to close with some thank yous. I thank you all here and online for joining our center's seminar today. This is the beginning, we hope, of a good conversation and new action steps in the future. And to that end, if you found this interesting, I want to point out that we have a sheet on our third term seminar series led by Dr. Jonathan Asani on current issues at the intersection of transportation safety and technology. So more on this topic in depth. We welcome anyone and everyone to those seminars. So pick up one of these on your way out if you'd like. So thank you again to our distinguished speakers. And I have to thank everyone here at the Bloomberg School of Public Health who played an important part in today's event. Our external affairs and multimedia team are terrific, as are our department's communications and administrative folks, who I thank, especially Edith Jones, Susan Murrow, and Josh Asprell. Our center has a transportation team without whom none of today would have been possible. So I'd like to thank them in addition to Drs. Frateroli and Pollock Porter, Jonathan Asani, Jan Vernick, Vanya Jones, Wendy Shields, and Eileen McDonald had a big hand in shaping today's event, and we greatly appreciate you. Finally, we're indebted to our colleagues at the National Highway Traffic Safety Administration, in particular Jeff Michael, for the expertise that informs much of what we do in transportation safety. As I mentioned, we hope that today fuels a rich and ongoing conversation and collaborations on how together we can inform and guide the rapid developments of this wonderful, potentially life-saving technology. So thank you all again. Enjoy the rest of your day and drive safely.